Good morning. I'm Dr. Harikrishnan Parthasarathy, a cardiologist practicing in interventional cardiology in Apollo Hospital, Vanagaram. I am very pleased to meet you all in this live session on what's a heart attack and what are the causes for it, and what is the way to deal with the heart attacks, and what the lifestyle changes we could positively make to improve the quality of life after heart attack. So heart attack is something which comes as a big shock for all of us. When we go through it, your loved ones go through it, or yourself. I'm sure a few people would have experienced it themselves. It's a big shock actually. So what happens is, like, coronary arteries are the blood supplies to the heart, and they are running on the surface of the heart. So when they have a blockage due to cholesterol or a clot or calcium, then it turns out to, if it completely blocks it or partially blocks the blood supply to the heart, then it ends up causing a heart attack. So heart attack can be a disaster for lots of people, but the modern medicine is in such a way that it can very quickly, if the help is sought, then it could be cured completely if the patient presents within the golden hour, that is within the first 6 hours after a heart attack. Then you could actually minimize the damage, or completely no damage to the heart muscle can actually occur if the emergency medicines and what we call a primary angioplasty is done. So what are the symptoms of a heart attack? Basically, when people have a heart attack, they experience some sort of a discomfort, or lots of people, 50% of people may not experience just discomfort. They can have a presentation in other ways, like a silent heart attack, which they don't have any symptoms at all, or they could actually have something like a sweating or indigestion type of symptoms, or they could have a shortness of breath, and that could indirectly you should have a high index of suspicion. Is this related to the heart? And then often you have to seek the help of the experts regarding this. And often it is very difficult to diagnose over a phone, or when you tell the symptoms, we have to run some tests as a cardiologist ourselves and take an ECG, and along with the symptoms and your risk profile, we have to decide whether you are having a heart attack or not. And this is an issue because people often don't take any health checkups for a long time, and people actually wait until they have a problem. And I would suggest all of us should take regular health checkups these days. Even as much as young as 25 years, I think we should seek help of general health checkups in the form of an exercise test, and an echocardiogram and an ECG if required, and that could actually help us diagnose heart attack or symptoms of heart blockage early. Actually, is this patient prone for a heart attack? So if you take at the risk factors, there are risk factors. So one of the person is asking, what is the difference between good and bad cholesterol, and what should be my levels? That's one of the questions Mr. Gunasegaran is asking. I would come to that. Amongst the risk factors, there are risk factors like risk factors we could avoid, which is high cholesterol, things like high blood pressure, which we have to have regular checkups, and diabetes, and poor exercise. Actually, so these things we could avoid. So when you come to good and bad cholesterol, good cholesterol is something called what we call a HDL cholesterol. HDL cholesterol is like a scavenger. It takes the bad cholesterol back to the liver for digestion. On the other way, the bad cholesterol is something called LDL cholesterol, which ideally is the one which is giving the energy to the body. On the other hand, if it is too high, then it should be reduced as much as possible. Now the guidelines are saying for somebody with a bad cholesterol of less than 130, and otherwise normal individuals, it is okay to diet and exercise, manage it. On the other hand, if somebody has already had a problem in the form of heart attack or a stroke, then, or even a diabetes, then the LDL cholesterol should be less than 70, and HDL cholesterol should be above, good cholesterol should be above 40. Somebody is also asking what kind of examination and a test will be performed to evaluate the severity of the condition. then what we should be doing is you should seek a good general physician or a cardiologist who could go through a history and your risk factor profile, and then we could actually easily diagnose predisposing factors. In the form of run a few basic blood tests, take your height, weight, blood test, BP, then cholesterol, sugar. These things should be measured. Rare risk factors like uric acid, homocysteine levels, all these things could also be measured. And then a basic ECG, echo and treadmill should be done as a part of a screening for a heart problem. So on the other hand, non-modifiable risk factors include age. The older we are prone for a heart attack. Then the things like the risk profile of your family history, and then how genetically you are prone. That is very important. And also males are little bit more prone compared to females. Somebody is asking what is the high cholesterol food items, what recommend food items we should be avoiding. So high cholesterol items are including in our day-to-day practice. I think mostly the snacks we are eating have high cholesterol, saturated fats, fries, people who have regularly or used to some sort of snacks, especially in the evenings, like samosas, bhaji, bonda, all these things as a South Indian or a North Indian type of food. I think we should be avoiding. Lots of carbohydrates can also be converted to cholesterol, which people often don't know. If you look at the portion of rice we are eating is too big compared to the vegetables and fruits we should be eating. Fruits and vegetables should be minimum 5 portions a day, and plenty you should be eating. You should be eating lots of fruits and vegetables compared to the rice we are eating. And high cholesterol items, anything done in ghee, dalda, and things like like vanaspati or palm oil, coconut oil. These things have high saturated fats. Any oil should be used in moderation and should be avoided. Like lots of junk foods, like pizzas, burgers, any convenience foods. You should know exactly what is going in. Often the lifestyle these days are very there is very actually fast lifestyle, and you should just grab a bite on the way to your work, and such things should be avoided. You should have enough time in eating and taking enough rest and exercise actually. Now, when we look at the symptoms of a heart attack, symptoms of the heart attack can be anywhere from the jaw until the umbilicus, anywhere in the front, back, left, right, or behind the shoulder. You could have some discomfort. It may not be a severe pain. It could be like a gastric burning type of symptom. These should be identified early, and you should not just ignore it for acidity. Often we put it down to acidity, or it is not going to be me having a heart problem. Those things should be avoided. And things like abnormal sweating, especially after eating, after meals, if you're trying to climb up stairs, or if you're doing something strenuous, if you get breathlessness, that is one of the early signs. Old people may not have classical signs. They should seek the help of a doctor to diagnose it. On the other hand, if somebody used to do certain exercises, unable to do, that could be one of the early signs actually. Breathlessness is one of the other signs of a heart attack. So you should actually, or predisposing factors for a heart attack. So you should actually try to diagnose things early, and then deal with it very early also. After a heart attack, what actually happened? Two types of heart attack. One is a complete blockage, which is called a ST elevation myocardial infarction. One is non-ST elevation myocardial infarction. The ST elevation myocardial infarction, the time is very precious. First 6 hours, as I told you, is a golden hour. You should directly go and seek medical help. Often these days, used to be in olden days, angio was not available. So we used to do thrombolysis and then shift the patient to a higher center actually, especially now in Chennai and even in suburbs. Lots of experienced cardiologists are available. You should go to one of those centers and get yourself checked, and then if necessary, a procedure called an angiogram is done, which is like a small tube inserted under local anesthesia, which is not a very high risk procedure, and then taking pictures. If there is a block, it should be immediately opened up by means of ballooning and stenting, which is again, the risk of doing such things is less than 1% actually. We usually quote a risk of 1 in 300, and people will be completely cured from the blockages. On the other hand, if you procrastinate, delay, and you think it is a gastric, you take your own medication, and then you actually take lots of time to seek the medical help, then it's going to be a problem. So after a heart attack, what usually happens is like we put people on medications to take it lifelong. And again, that is not often people are apprehensive about taking medications, about doing a stenting procedure. These things are very time-proven procedures now, and it's been proven definitely to prevent damage to the heart muscle. The heart left ventricular ejection fraction is the pumping strength of the heart is usually around 60%. After a heart attack, if things are not done well, usually the pumping goes very low, actually as low as 20% to 30%. And if you do a timely intervention in the form of an angio or an angioplasty or in thrombolysis in remote areas, then the pumping is bound to stay high, like 50 to 60%. It can remain like that, and then that will prevent the person to having breathlessness and chest pain in the future. After a heart attack, then you usually continue taking some medications, which is for preventing cholesterol buildup in the future in the stenting area and also in the adjacent areas, and to prevent the non-heart attack areas to have future damage. Often medications are given to prevent high cholesterol buildup, things like aspirin and similar medications to prevent a clotting, and also to improve the pumping of the heart. Certain medications are given, might be 2 to 3 medications you might need to take for a longer term. And you should be very compliant with the medication. If you look at the compliance, there is a big issue throughout the world. Less than 50% only stick on to the medications, and that is a very bad sign, because often people forget to take medications or don't take medications regularly. And the other thing we have to do is like post rehabilitation, post a heart attack is actually very fascinating topic. Actually, often people think, oh, my life is gone after a heart attack, and that is a misnomer, because I have lots of young people, even newly married people, having a heart attack and successfully continuing with their lifestyle and having children now post heart attack within a year or two, and they lead a very healthy life. They have revolutionized the way they lead their lifestyle. So lifestyle is very simple. It is not rocket science. Basically, you start off with good food. So food is the main bane for Indian people, I think. Actually, what we should be doing is like whatever goes into the mouth is going to get digested and should be utilized that day. If you think that day you're not going to do enough exercise, then better avoid that. I always say a few minutes in the lips, lifetime in the hips, actually. So if you eat something, it's just a few seconds you're going to taste that, but you're going to carry that in your abdomen all the time, actually, with increased weight gain. That is one thing. Second thing is like regular exercise. Actually, people think what they're doing, the routine work counts to exercise, which is often not the issue. Especially ladies, they do regular housework. They are very conscientious and they do plenty of housework. They often forget about their own health. Actually, they look after their husband and children, but they are not taking care of their health at all. Often what they should be doing is like take some time off their regular routine, half an hour to 45 minutes, some sort of exercise, even in their house itself. Actually, yoga, it's just a simple yoga mat. They can take some good shoes on, go for a gentle walking outside, and then that half an hour they should be able to build up the energy to sustain the amount of energy they need to maintain good exercise. Often if you have the heart rate should be going high during your exercise. So people are afraid of that. Actually, people say, sir, after a heart attack, can I increase my heart rate? That again is a problem. And often the people who are looking after them also create lots of doubts in them. You should not do this, you should not do that. That should be avoided. So people gradually get back to work. They have to, first week or so you do for 10 minutes a session for 3 to 4 times a day, counting to total about 30 minutes, 40 minutes a day. And then you gradually build it up, and you can do at one stretch, you can do after probably 2 to 3 weeks, 4 weeks, you can go for 45 minutes to 1 hour walk yourself, actually, not a problem. That's similar to the rehabilitation we follow even after a bypass surgery and even after an angioplasty. Same thing counts. About driving, probably for a month or so, avoid driving. After that, depending on your condition, we could be able to allow you to go driving, actually, if you have no issues. For example, some angioplastic procedures are done prophylactically before the heart attack. Those patients, no need for problems in driving. And after a heart attack, first 1 month, generally avoid driving. Second is having sexual activity. If you have a partner or a wife or whatever, the sexual activity is not a problem post heart attack. If you are able to climb 2 stairs of flights without any breathlessness, then sexual activity as such should be encouraged, and you should do that, because it actually induces good hormones in your system, and it actually builds a positive attitude, and you should have the open mind towards that also. And fourth is basically build up a positive energy, think positive. And often people say, oh my goodness, what's happening, what am I supposed to do, I'm only 40, I have another plenty of responsibilities. But take things easy. Always don't keep rushing, don't keep attending your phones, don't keep thinking something is going wrong, you should be there. You take gas off the pedal, you take a few steps backward, think about your life, and you spend enough time enjoying yourself, take enough time off your routine, spend more time with people who make you feel happy, and then that is the psychological well-being counts a big step ahead, and that makes a big difference in the way you actually perceive your problems, and you can overcome it. I would suggest post heart attack you could live a better life compared to what you would have led before a heart attack. And that is very important. Keep yourself travel a lot, take breaks every 3 months. Once you take break off your work. And often people say, I can't do it, my wife doesn't, my type of work doesn't allow, or my family doesn't allow, which I think if you take effort you can do that. So I would see if there is any further questions here. And then so what type of foods help me to control my risk of disease? So for that I would suggest you take plenty of fruits and vegetables and less carbohydrates, and no, avoidance of non-veg is not important. You could take in moderation, weekly once or twice, and take lean meat. Don't take lots of fatty foods and with skin and fat in it. One question is, sir, if HDL is within normal range but LDL is slightly higher than normal of a young man of 26, is it a risk factor? So Mr. Indrajit is asking, I would suggest you actually look at the whole profile. LDL is slightly higher, it's not a major issue, but you should try to bring it down below 130 if you don't have any other risk factors. If you have a risk factor like a diabetes, or if you have already had any heart problems, then you should actually try to bring it below 100 and even 70, which is a diagnostic test should be included in the initial assessment. Initial assessment should include ECG, echo, and if patients can do it, needs a treadmill. And if there are lots of things like even a CT scan angiogram, which is a very good test to directly see the coronary arteries. If necessary, we could do it. Mr. Wilson from how common is the heart disease among women? So men and women, usually during the until menopause, the heart disease is lesser than men because they are protected by estrogens. But after menopause, the risk very steeply increases to that of the men actually. So you should be wary of that. In India, we are not proud of it. India is the capital for heart disease and heart attacks, and India is the capital for diabetes actually. Priyanka is asking, sir, basically low fat diet prescribed. Low fat diet, basically fat should be less saturated fats, but less carbohydrates also very important. Lots of proteins and fresh vegetables and fruits you should take. Fresh vegetable and fruits, wash it well because lots of pesticides in it of late. Wash it well and cook it before eating actually. Ruben is asking, good morning doctor, how can I make my weak heart stronger? So for that the basic difference is medications and exercise. Take plenty of exercise, whatever you can within your limits you do. Gunasegaran is asking, what is the difference between heart attack, heart disease, and heart failure? So heart attack means damage to the heart because of lack of blood supply. Heart failure is because the pump is weak. Often the pump is unable to supply the demand of the body, and that is the reason called heart failure actually. Can you explain about pacemaker? Vikram is asking. Pacemaker is done for people who have electrical problems in the heart. When heart is unable to generate the electricity, like the heart rate should be around 60 until 100 in a normal person in a resting state. But on the other hand, if it is too slow, or if there is a problem in the conductivity of the heart and block, then pacemaker is done. Pacemaker is a small procedure done under local anesthesia with a little box like a generator inserted, and two wires usually are inserted through a vein to go deeply into the heart, and it actually corrects the electrical abnormality of the heart. Somebody is asking at what duration the regular checkup should be done for a heart failure patient. Heart failure patient usually 6 months once, I would advise. Usually it is in the form of either that's just 1 minute. There is some problem here in the thing actually. Okay. What duration means? Usually 6 months once blood supply, blood checkup should be done, and yearly once echo and treadmill, if you need be, or ECG should be done. Thomas sir is asking, are stents safe? Stents are very safe. There is less than 1% chance of blockage inside the stents per year. Usually stents nowadays are drug coated stents which prevents any blockages inside. Usually the area adjacent to the stent gets blockages because of the bad lifestyle of the patient, or cholesterol is not controlled. Usually stents as such are very safe, to be honest with you. Can heart failure patients do fasting? We know Surya is asking. Fasting, extreme fasting is not advised in heart patients. And nowadays people can fast for 1 day continuously, which because in such cases medications get upset. Actually, I would suggest small fasting for a one period, for example morning fasting. Such things can be adjusted, but full day fasting and all should be avoided. Actually, what should I do, what can I do to feel less stress and worry, which Naga Kishore is asking, which is $1 million question actually, Naga, because it is if I know the answer, I would have been a big millionaire or billionaire until by now. Actually, less stress and worry is to make yourself look at the positives what you have done in your life. So you would have done something good that day. You take 1 day at a time. You think, say for example, this morning I went for a jog. I went to the gym and then went for a jog with the family in the park. And today I made myself de-stressed first thing in the morning, and that gives me positive energy. I'm a very busy person. I have to go to the 2-3 meetings today, and I have to continue with my lifestyle, work, and family balance. You hit the balance and look at the positives in your life. Somebody has a doubt called Kalai Selvan is asking, sir, I have a doubt. Can yoga reverse the damage to the heart? Of course, yoga does plenty of good things for the heart. Do it under guidance. Take the help of an expert. Punya Prabhu is asking, nowadays too many young age people are getting heart attacks. So Punya, basically it is because of lifestyle changes. Eat less, work more. Before you put anything in your mouth, think, is that really necessary for you? Don't take stress. We have plenty of money, but not really following good lifestyle. So you take time off, become like a villager. Go out, do some gardening, put your hands in dirt. Actually, go and do some work, and go and do something energetic with your family and friends. Sir, soft drink can affect the heart. Definitely, don't go near any carbonated soft drinks or sugary drinks. Don't drink them. If you drink, do occasionally, but don't go near them. It is bad for you. Can I do? How do I feel less stress and worry? Again, they're asking. Priyanka is asking, avoid junk foods, fake low-fat diet, improve lifestyle modifications. Good. Somebody has told that actually. Suffer patient with MI and high-risk diabetes also because postpartum. How can you prevent cardiovascular disease? Ranjit is asking. So I would suggest, keep your sugar under control. Go to a good diabetologist and do plenty of exercise. Somebody is asking, I have had a heart attack a year back, but can't able to control smoking. I smoke at least 2 cigarettes per day. Can I? Yes, definitely. One is too many. Smoking can build up a clot very quickly inside the heart's blood supply and cause a heart attack. So kindly avoid smoking at any cost. Just put them away. I'm sure you can do it. Do that. Soft drinks affects it. Yes. Side effects of a stent. Usually stents, in the less than 1%, as I told, during the procedure, sometimes we can have a damage to the blood supply when we insert it. Usually done under very trained hands, nothing will happen. And in the longer term, usually you do more benefits than damage. It can become a clot or restenosis inside. All of them put together less than 1% only. What kind of lifestyle modifications we have discussed about that? How can you live with the heart failure? Ruben is asking. I would suggest you have less salt in your food. because salt can build up water, and the heart is already pumping weaker, and the heart failure, then you can damage the heart by dilating it. It becomes bigger with more salt. And drink less water, less than 1 to 1.5 liters per day maximum, and then do plenty of exercise and take good care of your body, lose weight, and do plenty of exercises, and stick on to your medications. Sir, can if normal people daily smoke and drink? Definitely. Normal people is not normal. If you daily smoke and drink, then it's actually abnormal, isn't it? Actually, Messi is asking like that. Punya is asking, how will I identify that it is really attack or gastric? So that is very difficult. You have to seek the help of a doctor, take an ECG and blood test called troponin. Troponin is a very sensitive test. If it is done after a chest pain, after 6 hours, if it is negative, if the severe chest pain, then it rules out a heart attack. So you go to a nearest hospital where they can do a troponin test, and that can easily identify whether it is a heart attack or a gastric thing. Before 30, can you get a heart attack? Plenty. I have 100, 200 people before 30, big heart attack. So be very careful. What is the latest stent technology? Nowadays, stents are drug-coated stents. There are bio-reabsorbable stents which has been there. Now it has been taken off the market, but again they are refining it, thinner struts. That in that technology, the stent is completely absorbed after a couple of years. There will be no stent inside. That's a very good technology. There is lots of the way the medicine is coated. There is lots of different way it's being done actually. So lots of different way things are happening to prevent the narrowing of the stent in the future. Dual antiplatelet therapy. So how long we should give? So when after a heart attack, somebody is asking, we should give 2 medications like similar to aspirin. Usually we give it for a year or so, and then we can switch over to single antiplatelet therapy. Actually, provided the patient is properly taking the medication. Somebody is asking, does refined oil have any role in this? So refined oil, there is a lots of hype on this, but I would suggest refined, non-refined, not a major issue, but you have to take less oil and go for cold press oil if you can overall. But refined oil also not major issue at all actually, I think, but you can take it less. Gastric irritation, have female patient but feel heart pain. Is it possible? Yes, they can have both together. So those are all the questions I've answered. So after a heart attack, you could have a positive impact, lead a very healthy life, take time off, de-stress yourself, think why you are leading this hectic life without really improving your health and without de-stressing yourself. What is the use of earning money? What is the use of going behind things? What is the use of going behind wealth and your aim for life, buying a car and getting this house and looking after your children? All these things are stressful. Life is never going to be easy for all of us. From children until old age, people always complain about stress actually. So you make sure you actually have a method of relaxing every day. Don't think about in 10 years what I will be there. Today, you think about today, am I living happy? And take time off, lead a happy life and healthy life. And whether having a heart attack or not, prevent a heart attack. And heart attack comes, I don't think we are losing much. Seek the best help possible, and then take positive steps and make sure that small hiccup you had as a heart attack, you make a positive change out of it. And I am sure you can lead a lot more healthier and happier life without cutting short on how many years you're living. You can live up to 80, 90, even after a heart attack, very healthily. But it is up to you to change. None of the doctors, Harikrishnan can't come and do it. It's up to you to do it. Thank you very much. End